Care for Yourself, the program offers breast and cervical services, screening services for women. We do 21 and older for cervical, and then 40 and older for breast. We do cover diagnostic testing if they are needed or recommended by a provider. It's important because women who normally wouldn't get in for screenings get in. Cost is a huge barrier. Insurance doesn't always cover everything. Co-pays, deductibles, everything's very high. So a screening may not be important to a woman who needs money for other things. And women always take care of themselves last, so it reminds them that they can get in, it'll be covered, and early detection's the key. I think there's a few components that help make it successful. First of all, we schedule the appointments for women. So they tell us what works for them to schedule, and we call and schedule it in the time frame that they need it for them to work. And then we also have a great rapport with providers. We are able to contact them. They know who we are. They set up referrals for us. They call us if they have a woman who doesn't have coverage to see if we can cover them. So I just think that the partnership with working with the women on what they need for appointments, and then working with providers for helping them keep their women screened makes it fantastic. It works well.
It was time for my yearly mammogram, so I had only gotten one just the year before I'd gotten my first one.
Okay.
I didn't start getting them at 40 like I was supposed to, I mean, I hadn't gotten my yearly checkups for 12 years before that, just busy with life and not doing it. And you can make all the excuses, like, no, I'm afraid it's going to hurt, or, don't have the money. Yeah, I know I have insurance, but, you still got to pay a deductible. I just don't want to deal with. So just all the stupid excuses. Just when I was looking up the number for the breast center in the phone book, or on Google, I happened to show the Care for Yourself program, the nights for that, and I'm like, well, I want it in the evening, and why not? And whatever they can turn into my insurance, and then they can pay whatever. And, the first time they said, well, if you don't hear from us then in a week or something like that, we'll call you back in a couple days if there's something wrong. The first year. So this year they said the same thing, and so like 2 days later I got a phone call. I'm like, that makes me a little nervous. So I went back and I took my husband with me this time because I just knew I was going to get bad news. And they came back in and said that it was positive for breast cancer. So that was a tough thing to hear. I'm glad my husband was there with me. Like, what if I wouldn't have gotten that mammogram? If I wouldn't have gotten the first one done, I would never have gotten the second one done. I'd be walking around with breast cancer right now and not even know it. And so by the time we found it, it would have been, because it wasn't even palpable. It was so small that the doctor, even knowing where it was, couldn't feel it when he did a breast exam. So it was very, very small. We caught it really, really early. But had I never done that, I'd be walking around with breast cancer, and in a couple years, then maybe it would have been stage 4, maybe it would have been too late.
It's really a good feeling because a lot of these women, like I said, would not get in for coverage or would not go in for screenings. So when we can get them in and pay for the screening and they find out they have breast cancer, they caught it probably early. We can get them in, we can get them the treatment they need, whereas if they held off until it becomes a problem, there could be a lot worse circumstances that happen from it.
Just do it. Quit making excuses. Just do it. Get it done. If you get a negative, great. You go on with your life. If you do have breast cancer, you want to find out early. Right. When it's small and can be treated easily.